you everyone for your interest in this topic and commitment to One Health in Action. This is a really amazing event, and I'm so excited to see the projects and learn from them. So I'm talking today about One Health policy, and I'll just make sure that you can see my slides. If any issue, just chime in. But I think One Health policy is a really interesting area of work because we really do policy in our everyday lives. We make decisions at the grocery store. We make decisions about whether to vaccinate our animals. We're really dealing with One Health policy all of the time, and we sort of don't always think about that. But there's policy at individual level, at government level, at global level, at business level. So I think, there's all of these opportunities to really make a difference on One Health policy. And I'll show you a few examples, but really looking forward to seeing how you're applying One Health policy in your projects as well. Just to show here, currently I'm based in Vermont, which is quite near Canada, just south of Montreal. I grew up here. These are some of my favorite animals that actually live in my backyard. So always really thinking about, species and our connections and just the beauty of biodiversity. So just to briefly tell you a bit about myself, I started in the One Health field through a summer internship working with a local Department of Health. And I was collecting dead birds that summer, working on West Nile virus. And, there's this amazing sentinel value of birds to be able to detect when there's circulation, when we would see increase in cases potentially in humans and horses. And it's a little easier to do sometimes than mosquito sampling and testing. So it was great because I would put up these signs and get calls about birds that people were finding, in their yards, just in their daily lives. And then I would pick them up and send them to the lab, and also get to present at senior centers and community events and national, parks, state parks about the risk and risk reduction. It was really an exciting opportunity to see, how connected people are to their health, and really, the public element of public health, and of course the environmental and animal dimensions. I went on from there to complete a degree in biology. I worked in some offices at the Attorney General's office, in a hospital, sort of exploring, how can I get involved in this field and make a difference. And then in 2010, I had the great opportunity to join EcoHealth Alliance, and just last year, I completed a PhD in environmental planetary health sciences. This is just to say that there's no right career path. It's so exciting, the different paths that you're pursuing, and I think we can all make a difference by bringing this different expertise and working together in new ways. So just to kind of, discuss the origin of One Health, I think it's a term that is so exciting, and it gets a lot of attention and a lot of interest now, rightly so. But, where did it get started? So my wonderful boss at EcoHealth Alliance, Dr. William Karish, was quoted in the Washington Post, and he was talking actually about Ebola virus, and how he was seeing gray ape die-offs in Central Africa. And these were actually linked then to a few weeks or a few months later, there would be human cases. So, seeing that this is happening to multiple species, and there's this sentinel value, and there's just One Health. So I think this very kind of organic generation of the term, it wasn't something kind of strategic. It was just really this elegant term that captured the situation. I think that's important when we then look at, what is One Health policy? There's nothing globally or nationally usually. There's starting to be some legislation about One Health in many countries, but it's not like it was something that had a strategy and was sort of implemented. We sort of have to think really creatively about how to pursue One Health policy and the different opportunities to do that. Emily mentioned that I worked on the World Bank's One Health operational framework. This was a really exciting opportunity to see, from the World Bank lens, how do we approach One Health and really put it into practice at a country level or regional investments. And something that we did for that project was look at, what's in place at a global level, the global best practice tools, the tools that countries are expected to use to meet certain targets for capacity, and then to evaluate capacity and to implement. So I know this figure is a bit overwhelming for me, but just to go through sort of what's here, we see that there are these different domains. We have human health, animal health, and agriculture, environment, and then something that's more multi-sectoral. Of course, there are many other domains and sectors that would be relevant, tourism, of course, and many, many others, finance. But we see that these processes are typically so siloed. It's one sector owns it. It's the health ministry that conducts the assessment. They don't always think about the colleagues responsible for wildlife health and for water quality and all of the other suite of things that we really need to think about when we are looking at One Health solutions. So I think at a global level, we have to be very sensitive to this, because this then translates to national approaches. And these ministries of health and environment and agriculture doing excellent work, but really not having those bridges to work together. And that's why we see, of course, many challenges where we don't maximize those opportunities, where we miss out on the One Health approach. So again, the key message from this that I learned was we need to think creatively about how to bring together these different processes, different different sectors in a way that is really realistic about the situation, that this does not happen automatically. I'm very excited about a One Health high-level expert panel that was just formed, and it's a partnership from 3 United Nations organizations, so the World Health Organization, the UN Environment Program, the Food and Agriculture Organization, and also the World Organization for Animal Health, which is also an intergovernmental agency. So they're working together, exploring solutions, and this high-level panel was just formed. There are 26 colleagues from around the world with different expertise, some in social sciences, some in economics, some in ecology, some public health surveillance, and I think a really exciting mandate in terms of providing advice, taking stock of the existing existing evidence, and then also looking at evidence gaps, and also really providing implementation guidance. And I'm a member of this panel. I'm really, excited about what it hopefully will achieve, but there are many other excellent panels at country level, at local level, and certainly at global level that are really trying to tackle these issues and provide solid evidence-based expertise that's very practical for implementation. So we need a lot of these efforts, and we need them really thinking across sectors and in new ways. So I think, an exciting time where we can build back better from COVID-19 and hopefully in a very strategic way. One aspect that I think is always important to mention, and you certainly, I'm sure, appreciate this from the projects that you're doing, is that context really matters when we think about One Health solutions. We know we need to be sensitive about human health, environmental health, animal health, the core sectors for One Health. But when we look at a specific issue in a specific country, we see that the context always varies. So sometimes the human health colleagues will have a really big role. Sometimes the animal health colleagues will be really the cost-effective sector to implement through. So we need to, really be pragmatic about how to approach that, and who is the right sector to lead on it, or the right stakeholder to lead on it. But in order to do that, we need strong human, animal, and environmental health systems. So our government colleagues really need to be capacitated to have the budget to do the day-to-day work, and when there's an outbreak, be able to know, should we invite the Ministry of Environment? Should they be part of the investigation? Would they have important insight to offer? And to do that, we sort of need this foundation of One Health understanding. Now, of course, we know that there is a lot at stake right now with the health of our environment, and there are many different effects, not just infectious disease, of course, but pollution, ecosystem degradation, and I think some of these studies that have come out in the past few years really show that link to an unhealthy environment, and the significance of these impacts every year or every day in communities, and then when we have a big event on top of that, like COVID-19, we see there's just so much direct and indirect impact from unhealthy environments. And what I think is really striking about that is when we look at the drivers of biodiversity loss and then ill health, and this specifically here is showing emerging infectious diseases, the drivers, so things like COVID-19, Ebola virus, what's really driving that? What are the major changes to our ecosystems, to our food systems? And we see that there's a lot of overlap with the drivers of biodiversity loss. So for me, I think that's a really compelling reason that the biodiversity community and the health community should be working together. We have common challenges, and by having a similar understanding of the issues and seeing where there can be benefits from working together, we can really optimize where there's resources, investments, projects, and protect both biodiversity and health. Now, I really love bats. This is something that's common to EcoHealth Alliance and many of our partners around the world. And bats, get a lot of attention. There are many species of bats, over 1,200 actually, and they're very diverse. And of course, bats carry different viruses and other microbes that can be pathogenic to humans, but it's really only the issue when we change the dynamics, when we come into contact with bats, when we cut down their habitat, and they're really beautiful animals. So I have this great appreciation for bats, and of course they are so important for our ecosystems. They provide pollination services. They eat a lot of pests, including mosquitoes. So we really want to be thinking about protecting bats and minimizing our direct exposure to them, but really making sure we can live in harmony. And I just wanted to go through 2 or 3 of those drivers of emerging infectious diseases that also threaten biodiversity. So wildlife trade has gotten a lot of attention in terms of being, a major risk factor for emerging diseases, and also for endemic diseases, for, gastrointestinal illness potentially. And, we sort of see the conditions and why it might be a high risk situation. There's these a lot of different species traded from many parts of the world. There's the local trade, there's the global trade. It's really hard to trace. The conditions are usually very crowded. You have many animals together. It's usually very stressful in terms of the welfare conditions, the nutrition, the water access, and just the stress that these animals are facing. And it's a huge, huge system. There is a lot of livelihoods that are generated from the trade. And I think it's important to recognize that the risk varies. So not every species presents the same risk in terms of an emerging infectious disease. But we really need to be thinking about how we're moving people and animals and how we're coming into contact with them. And of course, wildlife trade is a really important interface. Then extractive industries. This is timber logging, this is mining, oil and gas extraction, and there are a lot of different ecological changes when this happens, not just the one extraction. So we see that there's installation of roads, which then other people can use and enter forests that maybe they did not previously have access to. It's just easier then to get into the forest and do an increase in wildlife hunting. There's a lot of in-migration then, and people, going into these areas that maybe there haven't been people before, so they don't have prior immunity. And these are typically the biodiversity and disease hotspots. So they're often places that are primary forests that, really have a lot of mammalian biodiversity and provide a lot of ecosystem services and carbon sequestration services. And they're, the areas that we want to protect, but also recognize that there are resource needs. So I think a major challenge is that when there's a decision about these extractive industries, there's not typically a health risk assessment conducted. So we just don't know, what are the risks? Is it a high risk area? Is it actually a low risk area? But certainly we see that extractive industries, increases in malaria cases, that's very common. Other vector-borne diseases as well, and certainly, potentially zoonotic diseases. And then I think there's an element of predictability too. We know when these investments are happening. We know, where they're likely to happen in the future. There are projections about transit corridors, so road building, and huge amounts that are expected in the next 30 or so years, and where they're likely to occur. likely through areas that we haven't had a lot of people in the past. And that's important for local communities, many benefits. They can get to hospitals more quickly, be able to have new job opportunities. But, there's this trade-off about then you have greater access to forest areas and then potentially impacts on biodiversity and health. So the goal then is to move from, of course, disease response all the way over to the right to more to the left, to prevention, and to being able to know sort of what's happening that could lead to spillover, what's circulating normally, what's your baseline, and then work to really reduce the risk at the source, or at least catch it early, the early detection. I think it's really exciting and encouraging that there have been several global evidence syntheses. You may have heard of some of these, but there was recently one published from the Intergovernmental Platform on Biodiversity and Ecosystem Services, EPACE, a really thorough report on biodiversity and pandemics that looks at these issues. So if you want a really strong information source on this, it has a lot of different references, so definitely check it out. The planetary health report that came out a few years ago that really looked at, how our planet is changing impacts our health, and it's a really elegant presentation of it. And then some other great resources from WHO and others that, and these are just a handful of the many ones out there. And then also thinking about wildlife health. So this is something that I'm quite interested in. Emily mentioned my collaboration with the International Union for the Conservation of Nature, or IUCN. This is the really the global collaborating body that brings together different conservation groups and sets some strategic priorities, and also has a lot of capacity to do things like species threat assessments. They conduct the IUCN Red List of threatened species. So that's how we know, at a global level, how many species are threatened. Are they changing their endangerment status? Are they actually, becoming more protected and their populations are doing well? Or are they really, at critical risk of endangerment? So the IUCN is a really important group, and we've been working with them, my colleagues and I, to look at what do we need at a global level for wildlife health. Wildlife health often falls through the cracks. We think a lot about domestic animals, and we sort of know their pathogen diversity for a large part, so we can sort of predict what livestock diseases and zoonotic diseases may emerge. But what about wildlife health? We know there's a lot that we still need to learn, and we don't typically have the global authority and the national authority. That's changing, and I have to give great credit to some of the global institutions that are taking this on. There's a new wildlife health framework that was recently published by the World Organization for Animal Health. I think this is great progress, and we need to support countries to have the capacity to conduct wildlife health monitoring. And I think there's 4 key areas that we think a lot about. One is diagnostics and investigation. We know there are a lot of wildlife mortality events where you see many animals dying and you don't know the cause. This can be really severe. It could have a short-term impact on a population, and the population can rebound. That's always good news. Or it can actually really, push them towards extinction, and that's really concerning. And many countries don't have the comprehensive diagnostic capacity to really, do that investigation and determine what the event was from when it comes to wildlife. Reporting is another area that's a huge gap. We don't have a global reporting system for wildlife diseases. There is one, but it's voluntary. So there's not a lot of incentive to report to it. And then I think, just in terms of thinking about wildlife health, we need certainly to think a lot about human health, but we can't forget about wildlife. They're also at risk of emerging infectious diseases, some which actually can be transmitted from humans. So we need to be thinking more about prevention, and not just for humans, but also for animals. Now, if we think about policy, One Health policy and financing, so at a country level, we have country budgets, and there's an investment each year into, say, the agricultural services, the health services, and then the Ministry of Environment. Unfortunately, there's really poor funding of wildlife health services. So, countries just don't have the budget to go out and do that surveillance and see what's circulating in bats or the many other, other taxonomic groups and species. So we just, don't have the capacity on the ground to have that information and have a system that would detect something early on and allow us to mitigate it, to really work upstream, this upstream prevention. So this is something that we can advocate for. We can say we really need to invest in wildlife health services. This is something that can't fall through the cracks. And there are some really exciting resources coming out from the World Bank on wildlife health and the rationale to invest in it, and what you really need to think about at a national level when you build up this this capacity area. I also want to encourage you to get involved in international environmental conventions, and we hear a lot about the Paris Agreement on climate. I work a lot with the Convention on Biological Diversity, but there are many others, including conventions on mercury, on migratory species, wetlands protection, and many, many others. I think there are about 13 just under the United Nations Environment Program. And this is something that happens very slowly, the change in policy at these global levels, but it's such an important structure because then countries implement on that. So you sort of need that global vision, and then the countries have the benchmarks, they have the tools, investments are really aligned to that. So I think, make sure that you don't shy away from these conventions, and that you also see how they're followed at country level and where we can incorporate One Health considerations. I think, there's a lot of opportunity in the environmental conventions. If we look at something like protecting ecosystems, we also want to be thinking about the health value of that. And it gives greater rationale then to invest in that and really protect those areas. I'll just give you an example here. So the Convention on Biological Diversity, and this is the really premier UN agency on biodiversity, and they had these Aichi Biodiversity Targets, and one was on ecosystems and essential services safeguarding. And health is specifically mentioned, which is really wonderful. And so how do you actually put that into action at a national level? When you're doing your national plans, what does this look like? So the guiding questions for a target like this would be, what are the major ecosystems in the country? How do they provide, health benefits? What's the risk if we change those ecosystems, if we develop them into something else? What is the health cost of that? And so that's where you can start to prioritize and say, we need to make this a protected area. We need to monitor in the system. So I think it's these really practical questions, and we just want to make sure that health does not get left out in those decisions. Now, I want to talk a little bit about where to target resources. And this was a map that our colleagues did. This is the hotspots of disease emergence, and it's really a relative risk of zoonotic disease emergence from wildlife. So you can see here, yellow, that these are places that are really, the hottest areas for disease risk. Of course, disease, there's no boundaries when we see, bats move long distances, wild birds move long distances. But, I think this helps us to have a sense of where to make sure that we have strong systems in place, that we're conducting surveillance, that we have the appropriate health systems in place to respond if there is an outbreak, to minimize the impacts to local communities, national, countries, and then the risk of spread to the world. I know, I think later today, you'll hear from Dr. Jana Mazet, who has led the PREDICT project. This was a 10-year amazing project. So, she'll tell you the full details, but what I think was really exciting is that it took that map that we just saw and, started working in 32 hotspot countries and conducted surveillance efforts. There was a social science component, there was a biological component, humans were included, wildlife were included. And then, of course, this gave us so much information about how to do surveillance on the ground, how to do it in a way that is careful about biodiversity, does not negatively impact biodiversity, minimally invasive sampling methods, and really working with governments to say, what are the risk factors, and what should be in place to protect people, to protect wildlife. So there are so many policy implications from a project like this. I think when we talk about translating science into policy, it's not sort of all the way over here for the science side and then all the way over here for the policy. I think it's we have to see projects like this that are really operational, that give us strategies, and then we see practical ways to prioritize policy measures. And I'll just tell you a bit about the study that Emily mentioned in Liberia. So you can see here at the bottom, many partners are involved in this study, but this is an acute febrile illness project. So people are coming into hospitals every day with fever, not feeling well, and not really sure what the cause is. It could be malaria. It probably is malaria in many cases, but it could be something else. It could be loss of fever. It could be something that has not been discovered. We're really just not sure always in many parts of the world. We don't always have the access to diagnostic capacity to make a precise determination. And so in this study, we're looking at over 30 pathogens to see what's actually causing this sickness. Is it something that we don't know is present? Is it something that we know is there and maybe seasonal? And then is there evidence of zoonotic transmissions? We're also going back and looking in communities at both people and animals to see, do animals carry these same pathogens that we're seeing? We're then also looking really importantly at the risk factors. So conducting behavioral risk surveys, looking at, do people, are they involved in crop growing? Are they hunting wildlife? What do they do in their day-to-day lives? Do they have, animals that come into their house because their roof quality is not so good? So these really day-to-day exposures that might be happening, making that link with when people are coming into the hospital and sick. And that will help us to understand really from a One Health strategy, where to prioritize resources, where to implement policies, and to do it in a way that, is sensitive to really nutrition needs, livelihood needs. And I want to point out, for a study like this, it's really exciting. It's EcoHealth Alliance with our partners, including the National Public Health Institute of Liberia, the Society for the Conservation of Nature, which is really the main conservation organization in Liberia, founded in the year that I was born. So they have a lot of institutional expertise and knowledge. And then also the Liberia Chimpanzee Rescue and Protection group. And they're actually a wildlife sanctuary that's working with the government so that when animals are confiscated, that are illegally in the trade, do not have good welfare conditions. Often there's poaching and, killing of these animals. And they're providing a key resource in the country to work with the government and the wildlife services and make sure that trade is being stopped upstream. And then, of course, the Ministry of Agriculture and Georgetown University. So this is a multi-sectoral project, and I think the findings will really lead to practical One Health policy priorities. Now, I just want to mention that when we think about something like wildlife trade, there are all of these different points in the trade chain. So this is a supply chain. We see that if we're looking for, at all the way upstream at the source, so someone going out and collecting a wild animal, and then all the way at the end, we have, the markets, people selling wild animals in a market, and then going to a local end user, or shipping that animal live or their animal products all around the world potentially, and being in the international trade chain. What I think is really important here from a policy perspective is that the entry points to have an impact would be different. So in some cases, we would work with the local Ministry of Environment and Wildlife Services, that all the way, on the side of free-ranging wildlife. That would be the group that has the mandates, the legislation, the resourcing to be able to intervene there. Something like all the way over at the international end user, that would be a different group. So this is something that when we talk about targeting policy, we have to really be aware of who is the right agency, that can actually have the mandate to change what you want changed. I think this is very hard to figure out sometimes. It takes a lot of kind of, back and forth researching about who is that right authority. But so often policy does not work because it's not targeted to the right stakeholder that can actually make the change. If you are interested in wildlife trade, there was a great paper that I had the honor of working on through Legal Atlas, and it's called Wildlife Trade, Pandemics and the Law, and it goes into a lot of the challenges with the differences in mandates and in legislation when it comes to wildlife trade and disease risk. And it gives a really good overview about the different agencies at global level, at national level, and some of the gaps that we see because of that difference in mandate. I'm just going to go through very quickly to say that we want to also make sure that One Health policies are in place to reduce adverse consequences. So there are many ways that's relevant, but when we look at something like disease control, we see that sometimes there are these gut reactions where you have public fear and people will villainize wildlife. And it's, just a mistaken perception, but I think we need to make sure that there are good safeguards in place so that doesn't happen. And typically it's targeted at the wrong species. It's actually increasing risk in some ways, and of course has environmental impacts. So bats, wild birds, and other animals, we don't want them to be villainized. We want people to be aware of how to live safely with them and reduce risk at the same time. So this is a great book called Living Safely with Bats that was implemented through the Predict project, actually, and went out to many communities. I think it was launched in 11 different languages, and really, discuss the disease risk, but also the importance of biodiversity. And people loved it. School children, they love animals, and they really saw, okay, we need bats, but we don't want to come into contact with them. I think this is so important because then at a local level, they have ownership of that knowledge and can implement it in ways that work for their communities. But I just think it's such an exciting book, and I'm happy to share the link. And then just to talk about the economic rationale, we know that not just the health sector is impacted during an epidemic. Of course, we've seen that with COVID-19. But that also gives us opportunities for other sectors and policies in those sectors. So, getting the buy-in about who can actually be implementing the solution and frankly, paying for it, for the interventions that need to be in place. Sometimes it's the mining sector. Sometimes it has nothing to do with the health sector at all. Sometimes it's the Ministry of Environment and Ministry of Agriculture. For something like rabies virus, we know that if you vaccinate domestic dogs, you really eliminate the majority of the risk in most settings. So that's something that, the health sector, the human health sector would not typically do. It would be the veterinary services. So it's this, question of where to invest and who's the best sector to lead on that. Just to give an example too about trade-offs. So if we think about developing land, let's say for palm oil, we see that there's been, this huge spike in palm plantations around the world, and palm oil is in a lot of things. In some ways, palm oil is more efficient to produce than other things. So, there are some challenging decisions to make because some primary forest is being cut down very quickly for this production. We really have to, at a community level, at a national level, and then at a global level as well, say, what's gained when you develop that land, and then really what's at stake if you develop it, and what do you gain when you conserve that? And I think disease is something that we know is really important. I think you read the Dobson et al. Paper. It talked exactly about a scenario like this, where we need to be aware of the trade-offs and accounting for things more, more comprehensively, so we see the full picture. Just to show here, this is a beautiful place in Liberia on the Farmington River. There's this beautiful ecosystem, this mangrove ecosystem that it feeds into. But I think that there are so many positive benefits of ecosystems, and sometimes we forget about that when we hear all about the disease risk, the problems from unhealthy ecosystems. But all of these things that we take for granted every day, you know, that we can appreciate from ecosystems. And I think that's so important to have that framing as well, so people are aware. Just to show here, when we want to link conservation and health outcomes, you know, if we see something like an endangerment status, so this is like a hotspots, but for ecosystem endangerment. So the red here is critically endangered ecosystems. And what do we do there? So the conservation strategies, you know, we have all of these different options, and some are really more targeted to each specific ecosystem. So something like forest restoration, there may be many positive benefits, but there could actually be a disease risk as well, which is not to say don't do that, but you have to really be aware so that you're building in some, you know, some resources to monitor disease in that process, and, you know, reduce risk proactively. I just want to close with some upcoming opportunities that keep in mind. So I mentioned the Aichi Biodiversity framework through the Convention on Biological Diversity. There's actually a post-2020 UN biodiversity framework that's coming out. And, you know, I think this is really exciting. This will set the scene for the next 30 years on how we prioritize biodiversity conservation. We know, of course, the Sustainable Development Goals to 2030, and they include health and they include ecosystems, but they're so siloed, they're sector specific. We don't always think about, you know, how do we work to achieve the best outcomes for multiple Sustainable Development Goals? How do we optimize resources? How do we, you know, invest in ways that account for potential trade-offs and promote benefits? The Global Health Security Agenda is another great framework, and then the Sendai Framework for Disaster Risk Reduction. So, you know, the Disaster Management Authority really is covering all emergencies and ideally all risks. So I think that's another opportunity to get involved and make sure that we're really prioritizing prevention. I'll just give a really quick pitch to CUGH, the Consortium of Universities for Global Health. Many colleagues are involved in this community. There's an upcoming conference next year. I think there's a virtual and in-person opportunity. It's just such an inspiring and great conference, and thinking about a lot of the things that we're all thinking about today and in the next few days. So please get involved. Consider, you know, presenting your work there. I think abstracts are due in the next month or so. And I'll just close to say thank you so much for the opportunity, and I really look forward to your projects and any comments and questions. Thank you.